What's going on, you guys? It's your boy JT, and today we're going to talk about how to survive OBGYN as a third-year medical student. Stay tuned. Now, if you guys are new to my channel, go ahead and hit that subscribe button. I help third-year medical students just like you pass their exams as well as their overall rotations. Also, quick disclaimer, my phone has been broken for the last couple of days, so I have to use a backup camera. So if the video quality is a little bit low on this one, I do apologize in advance. All right, so the layout of this video is basically the same as all my other how to survive video in my video series. So we're gonna talk about what you should know in the clinic, what you should know how to study for your shelf exam, and we're gonna talk a little bit about how my shelf exam experience went and getting in a little bit into the details of my NBME test results. So let's go ahead and get right in. So for OBGYN, at least for my school, I had 2 weeks of OBGYN clinic, 2 weeks of OB labor and delivery, and then 2 weeks of OBGYN surgery. For clinic, you're going to want to know every single indication for contraceptives, as well as following up a patient that just delivered a baby. You also want to know what you need to do at every first OB visit, whether that be when the patient is 10 weeks or whether that be if the patient is 36 weeks. For labor and delivery, I want you to know every single indication why you want to do a C-section, as well as why would you want to do a vaginal delivery versus a C-section delivery. There's also something called a fetal heart rate interpretation. This is basically a monitor that they are placing on the mom to figure out what the baby's heart rate is doing to the contractions. There's a brilliant mnemonic known as VEAL CHOP. Basically, if you see variable decelerations, you're gonna probably assume cord compression. If you see early deceleration, you'll probably see a head compression, and so on and so forth. For GYN surgery, I want you guys to already know how to suture. Amazon has great kits for you to pick up knowing how to suture. I just bought one myself. And the more you know before going into your GYN surgery days, the more they'll let you do. So you'll be able to close up C-section, you'll be able to retract, you'll be able to help them when it comes to perforating the membranes to allow the baby to come out. Things like this will go ahead and move you farther along and allow your general surgery, or excuse me, your GYN surgery rotation to move along much more smoothly. If you're a guy, just know that sometimes the patient may not want you in the room. It's nothing personal, it's just the fact that with OB, it's a lot more female based, obviously, because of the fact that they are mostly women, or they are all women. Sometimes women don't want you to be in the room if you are male. It's nothing against you. I think I only got kicked out like 3 times during my entire 6-week rotation, which is pretty good. Just go ahead and always remember to introduce yourself to the patient during the labor and delivery phase, and make sure you go in with a female nursing staff of some kind. And if you're a girl, just know that there's been some instances where nurses, especially OB nurses, tend to be a little more aggressive if you try to be more assertive in your role. Don't ever assume just because you're a girl going into a GYN rotation or OB rotation that every single female patient is gonna just welcome you with open arms and allow you to touch their baby. Just kind of keep that in mind. Always respect everyone's space. All right, so for my schedule, again, like I said, I had 2 weeks of labor and delivery, and these shifts were always the longest. They scheduled me from 7 a.m. to 7 p.m. Sometimes I'd be able to come in at 8 in the morning and leave at 6 at night. So it would be a 10-hour day compared to a 12-hour day, but just expect to be doing a lot of waiting. A labor and delivery is a lot of waiting, but once the action comes, when the baby comes, it's actually very exciting. And I believe personally that being able to bring life into the world is one of the most unique experiences and most beautiful experiences that you will ever experience as a human being. For GYN surgery, that was typically my least heaviest days, but they were probably one of the most exciting. I learned in my GYN surgery days that I want to work with my hands. So I got to work with my hands a lot. I got to help out the surgeon with like suturing, retracting, getting to hold the uterus while they are doing a hysterectomy. It was very, very cool. And typically we would have about 3 cases, and we would go in at 7:30 in the morning and we'd be done probably around noon to 1 p.m. For OBGYN clinic, it varies, but I typically had a 8 a.m. to 5 p.m. schedule. And again, it was anything from, you know, contraceptive IUD placement to doing like a LEEP procedure, doing a colposcopy, which is basically looking at the cervix through a microscope, and doing a lot of like pap smears. So you got to do a lot of pap smears during that rotation as well. And then when I would be done with clinic or surgery or whatever it may be, I would be able to have time to study for my shelf exam. Now, this will be a little bit different with my previous videos. I know my previous videos, I typically recommended doing 20 questions a day for any type of rotation, but for me personally, I had to do 30 to 40 questions per day for GYN. Because of the fact that I'm not a female and I don't really know the female anatomy that well, so I had to really step it up when it came to studying. So I would recommend doing 30 to 40 questions of UWorld over AMBOSS. AMBOSS only has about 280 OBGYN questions and UWorld has about 500. So I definitely recommend doing all of UWorld before going to AMBOSS on this rotation. Obviously, every rotation is going to be different. Some students feel like they are more strong in the areas of OBGYN compared to other students. That's not the case for me. For me specifically, I am the weakest at OBGYN, so I had to do more questions. And that's the case for anything that you are struggling with. Do more of those questions that you are struggling with. I also highly recommend doing an actual MBME timed halfway through your rotation. So for me, it was 6 weeks. So I would do my halfway rotation or halfway exam at 3 weeks. This would have helped me determine, okay, what areas I'm weak in and where I need to study. Okay, so for the shelf exam, it was pretty tough. So backing up, about 4 days before my actual shelf exam, I took my first MBME. So that was my first mistake. I took my first MBME 3 to 4 days before my actual exam. And then when I took my MBME, I got a 58%. And I was like crushed. I was like, what's going on? There's no way I'm gonna pass. And I really struggled. I was like, should I just go ahead and just bomb the shelf and do it at the end of the year? But I said, no, you know what? I'm gonna stick it out. I'm gonna go ahead and do 120 UWorld questions every single day until I go ahead and take my second MBME. And that's what I did. I went ahead and did 120 UWorld questions for 2 days. And then on Tuesday, my exam was on a Wednesday, I took my second MBME. And on that MBME, I got a 83%. So I took my total from 58 to 83, and I basically got around a 69%. So I felt comfortable going into the actual shelf exam. For my school, they require a 65% in order to pass. For my exam results, I did get over a 65%. In fact, it was exactly the predicted average that I got from my previous 2 MBMEs, believe it or not. So MBMEs are really legit. They are a really good indicator of what scores you're gonna get on the true shelf. So for me, I took the scores, 2 scores, and I divided them by 2. Add them up, divide them by 2, and I got an average, and that's exactly what I ended up getting, and I ended up passing my shelf exam. And I was really thankful to the Lord because I didn't give up. I didn't give up. I didn't say, I'm gonna take this at the end, I'm just gonna bomb it. No, because you know what? I had a trip to Mexico. Sí, hablo español y soy mexicano. And I wanted to make sure I got to Mexico on a Thursday and I didn't have to worry about taking my shelf exam in Mexico or somewhere else, you know? So that's pretty much all I have for you in this video. Other thoughts and feelings that I had towards this OBGYN rotation, it is definitely by far the toughest rotation that I've had so far, both clinically, surgically, and academically. Why? Probably number 1, because it is predominantly female dominated. I don't really know the female anatomy that well. And number 2, the reason why it was so tough is because I didn't know where my starting point was. I haven't taken an MBME. I didn't know what a good base was before I went ahead and just studied regularly. If I would have pinpointed my mistakes early on, I probably wouldn't have gotten such a bad MBME score to begin with. Again, I highly recommend doing an MBME to see where you are at in the middle of your rotation and then building from there. And I recommend doing 30 to 40 real-world questions per day in order for you to succeed in your self-exam. OBGYN is a beautiful rotation. Again, bringing life into the world. It's super awesome. And I'm even considering doing OB as a fellowship post my family medicine residency. So we'll see, the Lord's in control of all that. But that's all I have for you in this video. If you like this material, go ahead and hit that subscribe button down below. You can also ask me questions on my Instagram at Julian Solo Torres. That's probably the best way to reach me. Again, I'm doing this all for you guys. And if you guys like the material, go ahead and leave a comment down below as well. Till next time, much love, peace out.